A 20 years old involved road traffic accident. Following the incident, he is unable to extend the wrist. However, this improves over following weeks. Which type of the nerve injury is most likely sustained? Here are the options. Options are the radial nerve neurotmesis, radial nerve neuropraxia, axillary nerve axonotmesis, ulnar nerve neuropraxia, and ulnar nerve axonotmesis. So, which is the correct answer? That means a patient involved in road traffic accident unable to extend wrist. We know the extension of the wrist is usually done by the radial nerve. So, here the radial nerve injury. But radial nerve injury, there are three type of the nerve injury. Which type of nerve injury we have to find? They are the axonotmesis, neurotmesis, and neuropraxia. So first of all, let's see the neuropraxia. In case of the neuropraxia, what happened? In case of the neuropraxia, nerve is intact. Only electrical conduction is affected. Myelin sheath is normal. So fully recovery develop and autonomic function preserve. And in this constitution, Wallerian degeneration not occur. So in case of the neuropraxia, there is transient loss of the function. But in case of the wrist extension, we know it is innerved by the radial nerve, and the most likely due to radial nerve neuropraxia. Now see the different type of the nerve injury. Here we can see this is the NAN, which is the NAN. That means neuropraxia, axonotmesis, and neurometasis. In case of the neuropraxia, here we can see in case of the neuropraxia, there is no injury to the axon, no injury, and here is completely preservation of the myelin sheath. So in this condition, there is some conduction difficulty in few days, and after that it is fully recovered, and here is no Wallerian degeneration. And in case of the axonotmesis, what happened? In case of the axonotmesis, here the axon is affected, so the axon is destroyed, and finally Wallerian degeneration occurs, and the axon usually increase in size. And the most disaster in case of the neurotmesis. In case of neurotmesis, there is completely transaction there. That means here the axon loss, and also there is the myelin sheath loss. So when there is the axon lost and myelin sheath, axon loss and myelin sheath loss, in this condition what happened? In this condition, Wallerian degeneration occurs, and usually this is bad prognosis. So Wallerian degeneration occurs in case of the axonotmesis, and in case of the neurotmesis. But in case of neuropraxia, no Wallerian degeneration and early recovery. In this picture, it is also very clear. In the first of on is the neuropraxia. In case of neuropraxia, the axon normal, and the myelin sheath is slightly injured. And in case of the B, which is the A, that means axonotmesis, here axon is damaged, but outside myelin sheath is normal. And in case of the type C, which is N, that means the neurotmesis. In case of neurotmesis, axon lost, only the myelin sheath, also the myelin sheath lost. So in the first case, there is no loss. In the second case, only axon loss. In the third case, axon and myelin sheath lost. So the most disaster is the third, which is the neurotmesis. So what is it? It is the completely recover after a few weeks. So it is due to radial nerve neuropraxia.